If you're over 60 and your feet are always cold, your ankles swell by the end of the day, or your legs feel heavy after sitting for a while, you've probably heard the same advice over and over. Just walk more. And while walking is absolutely good for your heart, your joints, and your overall health, there's one important fact that very few people ever tell you. Walking alone may not be enough to restore healthy circulation in your legs. I'm Dr. Nathan Ashford, and after years of caring for older adults with circulation problems, I've seen countless patients who walked every single day, yet still struggled with swollen ankles, aching calves, numb feet, and poor balance. Many of them believed they simply had to accept it as part of getting older. But that's not true. Poor leg circulation isn't just about discomfort. Over time, reduced blood flow can slow wound healing, increase the risk of infections, weaken your muscles, and make falls much more likely. In many cases, it's also one of the earliest warning signs that your arteries aren't as healthy as they should be. Here's the surprising part. The biggest problem often isn't your heart. It isn't your age. And it isn't the number of steps you take. It's a small group of muscles in your lower legs that doctors often call your second heart. When these muscles stop working efficiently, blood begins collecting around your ankles instead of returning smoothly to your heart. That's when swelling, cold feet, fatigue, and stiffness begin to appear. The good news? You don't need expensive equipment. You don't need intense workouts. And you certainly don't need to spend hours exercising every day. In today's video, I'll show you 5 simple exercises that help activate your body's natural circulation pump. Each movement builds on the previous one, and the final exercise is the one vascular rehabilitation specialists frequently recommend because it targets the calf pump more effectively than ordinary walking. Stay with me until the end, because the number 1 exercise may completely change how you think about improving circulation after 60. It only takes a few minutes a day, but for many people, it makes the biggest difference. Exercise #5, ankle pumps, the simple movement that gets blood flowing again. Let's begin with the easiest exercise on today's list. In fact, it may look so simple that you wonder whether it's even worth doing. But don't let its simplicity fool you. Ankle pumps are often the very first exercise doctors recommend after surgery because they help prevent blood from pooling in the legs while a person is sitting or lying down. Here's why they work. Every time you pull your toes toward your body and then point them away, your calf muscles gently contract and relax. That action compresses the deep veins in your lower legs, helping push blood upward toward your heart, instead of allowing it to collect around your ankles. Think of it as manually turning your second heart back on. If you spend several hours each day sitting in a chair, watching television, driving, or reading, your calf muscles remain mostly inactive. As a result, circulation slows, swelling increases, and your feet may start feeling cold or numb. This simple movement helps interrupt that cycle. Here's how to do it correctly. Sit comfortably in a sturdy chair with both feet flat on the floor. Slowly lift your toes toward your shins while keeping your heels on the ground. Then press your toes downward and raise your heels. Move slowly, not quickly. One full up and down movement counts as 1 repetition. Aim for 20 to 30 repetitions, 2 or 3 times each day. You can perform ankle pumps while watching your favorite television program, talking on the phone, or even waiting for your coffee to brew. One mistake many people make is rushing through the movement. Fast repetitions don't allow the calf muscles to fully contract. Slow, controlled movements create a much stronger pumping action and encourage better blood flow. If your ankles swell every evening, or your feet often feel cold after sitting, make this the first exercise you add to your daily routine. It's gentle, safe for most older adults, and takes only a few minutes. But while ankle pumps help restart circulation around the lower legs, they don't strengthen the larger muscles responsible for keeping blood moving higher up the body. That's exactly what our next exercise is designed to do. Exercise #4. Seated leg lifts. Improve circulation through your thighs. Now that we've activated the calf pump, it's time to work on another area that's just as important: your thighs. Many people think poor circulation only happens around the ankles. But the large muscles in your thighs play a major role in helping blood travel all the way back to your heart. As we age, these muscles naturally become weaker if we don't use them regularly. When that happens, standing up becomes harder, climbing stairs feels exhausting, and blood begins moving more slowly through the legs. That's why seated leg lifts are so effective. Unlike walking on flat ground, this exercise directly challenges the muscles on the front of your thighs, helping them contract more strongly and assist the veins that carry blood upward. Here's how to perform it. Sit upright in a sturdy chair with your back supported. Keep both feet flat on the floor. Slowly straighten one leg until it's almost parallel with the ground. Hold the position for about 2 seconds. Then lower the leg slowly without letting it drop. Repeat 10 to 15 times, then switch to the other leg. The key is control. Don't swing your leg. Don't lean backward. And don't rush through the repetitions. Each slow lift forces your muscles to work harder, which also helps improve circulation. If this becomes easy after a couple of weeks, you can make it slightly more challenging by wearing a light ankle weight of 1 or 2 pounds. A little resistance encourages your muscles to become stronger, and stronger muscles mean a stronger second heart. Another benefit many older adults notice is that getting out of a chair becomes easier. That may not sound exciting now, but maintaining that strength can help you stay independent for years longer. Because every time you stand up safely without needing assistance, you're protecting yourself against one of the biggest risks after 60, falls. Now we've activated the ankles and strengthened the thighs. The next exercise combines circulation with something just as valuable: better balance. Exercise #3. Supported calf raises. Strengthen your second heart. Now we're moving to one of the most important exercises in this entire routine. If I could recommend just one movement to improve both circulation and stability, calf raises would be near the top of the list. Why? Because every time you lift your heels, your calf muscles squeeze the deep veins inside your legs. That squeeze pushes blood upward against gravity, helping it return to your heart instead of pooling around your ankles. At the same time, you're strengthening the very muscles that keep you steady while walking, climbing stairs, or getting out of a chair. Here's how to do it safely. Stand behind a sturdy chair or hold onto a kitchen counter. Place your feet about hip-width apart. Slowly rise onto the balls of your feet as high as feels comfortable. Pause for 2 or 3 seconds at the top. Then lower your heels back down slowly. That's 1 repetition. Start with 10 repetitions. As your strength improves, gradually increase to 20 or even 25 repetitions. One of the biggest mistakes people make is bouncing up and down too quickly. When you rush, your muscles rely on momentum instead of actually doing the work. Slow movements create a much stronger muscle contraction, which means a much more effective pumping action for your circulation. Another common mistake is looking down at your feet. Instead, keep your eyes looking forward. This helps train your balance while strengthening your calves at the same time. Many of my older patients tell me this is the exercise that makes them feel more confident walking around the house. After several weeks, climbing stairs often becomes easier. Standing for longer periods becomes less tiring. Even the swelling around the ankles may begin to decrease because blood is no longer sitting in the lower legs for hours. But there's one thing calf raises can't fully train. They strengthen the muscles, but they don't challenge your balance enough. And after age 60, balance may be just as important as circulation. That's why the next exercise combines both, and it might surprise you how powerful such a simple movement can be. Exercise #2. The single leg balance hold. Better balance, better blood flow. Now we're down to the second most powerful exercise. At first glance, standing on one leg may seem like a balance drill and nothing more, but it's actually doing much more than helping you avoid a fall. The moment you lift one foot off the ground, your body immediately activates dozens of muscles, from your calf and ankle to your hips and core, to keep you upright. Unlike walking, where your weight shifts every second, this exercise forces those muscles to stay engaged continuously. That sustained muscle contraction keeps your calf pump working longer, helping move blood out of your lower leg and back toward your heart. At the same time, you're training your nervous system to react faster if you trip or lose your balance. This matters because falls are one of the leading causes of serious injury in adults over 60. The stronger and more responsive your balance muscles become, the more confidently you'll move throughout the day. Here's how to perform it safely. Stand beside a kitchen counter, sturdy chair, or wall. Lightly rest one hand nearby for support if needed. Shift your weight onto one leg. Lift the opposite foot just an inch or two off the floor. You don't need to raise it high. Stand tall. Keep your eyes looking forward, and breathe normally. Hold the position for 20 to 30 seconds. Then switch to the other leg. Repeat 2 or 3 rounds on each side. If this feels difficult at first, don't worry. Most people over 60 are surprised by how challenging it is. The goal isn't perfection. The goal is gradual improvement. As your balance becomes better, try using less support from your hand. Eventually, you may only need to keep your fingertips close to the counter without actually touching it. That small progression makes a huge difference over time. One important reminder: always perform this exercise next to something sturdy. If you have severe balance problems or a history of falls, ask someone to stay nearby until you feel comfortable. Over the next few weeks, many people notice they feel steadier when walking, turning around, or getting up during the night. Their confidence improves, and when confidence improves, people naturally become more active, which further improves circulation. But we've saved the most effective exercise for last. It combines everything we've practiced so far. It's the movement that activates your second heart more completely than any other exercise in today's video. And if you only choose one exercise from this entire list, this is the one I'd recommend. Exercise #1. The standing calf pump hold. The best exercise for leg circulation after 60. We've finally reached the #1 exercise. If someone asked me to recommend just one movement for improving circulation after 60, this would be it. It looks almost identical to the calf raise you learned a moment ago. But there's one small difference that makes it far more effective: the hold. Instead of lifting your heels and immediately coming back down, you're going to stay at the top for several seconds. That extra time forces your calf muscles to remain fully contracted. Think of your calf muscles as a second heart. When they stay contracted, they continue squeezing the deep veins inside your legs, pushing blood upward toward your heart, instead of allowing it to collect around your ankles. The longer the muscle works, the longer that natural pump stays active. That's why this exercise is so powerful. Here's how to do it. Stand behind a sturdy chair or hold onto a countertop. Keep your feet about hip-width apart. Slowly rise onto the balls of your feet. Lift your heels as high as feels comfortable. Now hold that position for 3 to 5 seconds. Keep breathing normally. Keep your posture tall. Then lower yourself back down slowly, over about 3 seconds. Repeat 8 to 12 times. As your strength improves, gradually work toward 15 to 20 repetitions. Don't rush. The hold is what makes this exercise different. Many people instinctively bounce up and down. Avoid doing that. A slow squeeze creates a much stronger pumping effect than quick movements ever will. Another tip is to focus on quality instead of quantity. 10 perfect repetitions are far more beneficial than 20 rushed ones. If your calves begin to feel tired, that's actually a good sign. It means the muscles responsible for pumping blood have finally been challenged. Over time, stronger calf muscles help reduce swelling, improve circulation, warm cold feet, and even make everyday walking feel easier. Now, I want to be honest. This exercise isn't magic. It won't reverse decades of artery disease overnight. But when practiced consistently, along with regular walking and healthy habits, it can become one of the most effective ways to support better circulation naturally. Many people begin noticing that their legs feel lighter. Their ankles don't swell as much in the evening, and standing for longer periods becomes much more comfortable. That's exactly the kind of progress we're aiming for. So how do you put all 5 exercises together into one simple daily routine? Let me show you the easiest schedule to follow, along with one important warning that everyone should know before starting. A simple 12-minute daily routine that actually works. Now that you know all 5 exercises, the biggest question is this: how do you fit them into your day without feeling overwhelmed? The good news is, you don't need an hour at the gym. In fact, this entire routine takes about 12 minutes. Here's the order I recommend. Start with ankle pumps for 2 minutes. This gently wakes up your calf muscles and gets blood moving after you've been sitting or lying down. Next, perform seated leg lifts for about 3 minutes. This activates your thigh muscles and helps move blood through the larger veins in your legs. Then move on to supported calf raises for another 2 to 3 minutes. Remember to move slowly and pause briefly at the top of each repetition. After that, practice the single leg balance hold. Spend about 1 minute on each leg. Don't worry if you need to hold on to a chair at first. Balance improves with practice. Finally, finish with the standing calf pump hold. This is the exercise that brings everything together. Perform 8 to 15 slow repetitions, holding the top position for several seconds each time. That's it. About 12 minutes. No special equipment, no expensive machines, just consistent daily movement. I recommend doing this routine once a day, preferably in the morning to wake up your circulation, or in the evening if your legs tend to swell throughout the day. And don't stop walking. Walking is still one of the best activities for your heart and overall health. These exercises aren't meant to replace walking. They're designed to fill the gap that walking alone often leaves behind. Before we finish, there's one very important warning. If you ever notice sudden severe pain in one leg, a leg that becomes pale, cold, or numb without warning, or a wound on your foot that refuses to heal, don't rely on exercise alone. Those symptoms may indicate a serious circulation problem that requires immediate medical attention. These exercises are intended for mild, long-term circulation issues, not medical emergencies. Now let's quickly review the 5 exercises one last time so you can remember them easily every day. Final recap and closing. Let's quickly review everything you've learned today. If poor circulation has been making your legs feel heavy, your ankles swell by evening, or your feet stay cold no matter how many socks you wear, remember this. Walking is important, but it isn't the whole solution. To really improve circulation, you need to activate your body's natural pumping system. Here's your daily routine one more time. Exercise #5. Ankle pumps. Wake up your calf muscles and improve blood flow after sitting. Exercise #4. Seated leg lifts. Strengthen your thighs and help move blood through the larger veins. Exercise #3. Supported calf raises. Build stronger calves while improving balance and circulation. Exercise #2. Single leg balance hold. Improve stability, reduce fall risk, and keep your calf pump working longer. Exercise #1. Standing calf pump hold. The most effective movement for activating your second heart and encouraging healthy blood flow back toward your heart. The best part? This routine takes less than 15 minutes a day. You don't need a gym. You don't need expensive equipment. And you don't have to be an athlete. What matters most is consistency. Your muscles respond to what you do every day, not what you do once in a while. If you practice these movements regularly, eat a balanced diet, stay hydrated, keep walking, and manage conditions like diabetes or high blood pressure with your healthcare provider, you'll give your legs the best possible chance to stay healthy and strong for years to come. Remember, growing older doesn't automatically mean losing your mobility. Small daily habits often create the biggest long-term results. If you found today's video helpful, I'd love to know which exercise you're going to try first. Leave a comment below and share your experience. I read as many comments as I can, and your questions often inspire future videos. If you enjoyed this video, please give it a thumbs up and subscribe to the channel so you don't miss our upcoming videos on healthy aging, circulation, heart health, balance, and staying active after 60. Thank you so much for watching. Take good care of yourself, keep moving, and I'll see you in the next video.